Well, it is a day many of us have been waiting for. Tomorrow, the state will be lifting mostly all COVID-19 restrictions, and many Bay Area counties are following suit. Dr. George Rutherford with UCSF joining us now to talk a little bit about what many are calling COVID-19 Independence Day. Would you go so far as to call it that, Dr. Rutherford?
That's a little bit of purple prose, but it has that feel to it in California, doesn't it?
It definitely does. You know, San Francisco's at 80% vaccination, Santa Clara as well, and all of our surrounding Bay Area counties are above that 50%, it seems. Talk to me just a little bit about whether or not there is a big risk at all if you're traveling in and around the Bay Area in terms of COVID-19. What does that risk actually look like?
I'd say the risk is limited to people who are unvaccinated or not fully vaccinated yet. They need to continue to be careful, especially if they're congregating in places where there may be a lot of unvaccinated people and where somebody can get in and who's infectious, and there could be very quick outbreaks, especially now with this Delta variant. It spreads much faster. If you're vaccinated, you're golden. Go do what you want. Go. If you're unvaccinated, get vaccinated. And if you're not going to get vaccinated, you need to be very, very careful.
Okay, so talk a little bit more about that Delta variant. How present is it here in California?
It's coming up in prevalence in California. It's about 4% currently, according to state data of all the strains that have been genotyped in the last month, which is up from about 1% of the month before. So it's becoming more prevalent. It's not going to displace the Alpha variant, the UK variant, anytime soon, but it could by the end of the summer, which is worrisome because it does spread much faster. It's just as the vaccine works just as well though against it.
That's what I was just going to say. But if you're vaccinated, you're pretty much protected against that variant and any others that are present here.
Not pretty much. You are.
Okay. Okay. Dr. Rutherford, a lot of people are going to start going back into the gym. Gyms are going to, take away capacity limits and that sort of thing. And it is safe for us to do that without a mask.
If you're vaccinated, yes, it is safe to do that without a mask. If you're unvaccinated, you should continue to wear masks.
That risk of people potentially going into a gym unvaccinated, not wearing a mask, obviously most places are just going off of honor system, right? So for those of us who are vaccinated, potentially in the gym or in the restaurant or something like that with unvaccinated people who may not wear their masks, how risky is that for us who are vaccinated?
Not really at all.
Okay.
The risk is from unvaccinated people to other unvaccinated people, especially if they tend to congregate together. The whole idea behind herd immunity, one of the pillars of it, is that the susceptible people, in this case the unvaccinated people, or non-immune people, are spread evenly through the population. Now we know that's not true. People are congregate by geography, by social groups, by age groups, by other things, and so we do have clusters of unvaccinated people, and they're quite susceptible to rapid transmission, especially of this new Delta variant.
So those of us who plan to start traveling, right? A lot of us wanting to get out of this bubble. Obviously, California is absolutely beautiful and, summertime, wonderful. But if we did want to go to another state where vaccination rates are not as high, we're still okay to not wear our masks?
Correct. If you're fully vaccinated, you're safe. If you're taking your little kids with you who haven't been vaccinated, they'll probably need to continue to wear masks depending on what state it is and what their rules are.
Okay. And do you see?
But you're absolutely right. California is gorgeous, and I actually been to Southern California and back, and it felt glorious to get out of Northern California, at least for a little while. Even to Southern California, it felt good.
Well, it really does feel good. I mean, obviously, the state is putting more incentives out, for people to get vaccinated. Today, the governor announcing some dream vacation packages that people are going to be able to win. How effective do you think these incentives are going to be in urging more people to get vaccinated?
The literature on them is pretty mixed. They seem to have been wildly effective in Ohio. But I think this school's still out on it, and we'll have to see how it plays out. But I'm glad but it's worth the effort, I think, to try and make it happen. Hammering away on how this is good for society is is one thing. But, what people need to remember is that this is a serious disease. I've talked to several people, had several patients over the last week with long-term COVID symptoms who had asymptomatic infection, and they are utterly miserable. And it's something to totally avoid. And the simplest way to avoid it is just to get vaccinated.
Definitely. When it comes to going forward, there is talk about the Novavax vaccine potentially looking for approval from the FDA come later this summer. How necessary is another vaccine for us here in America?
Well, we have. The question is why do we have 3 instead of just 1? And to have 4 instead of 1, I don't know. It may provide some modest help, but I think it's going to be much more useful overseas.
Okay. And, the governor is still keeping the emergency order in place, meaning he can still go ahead and make executive orders if need be. Do you see any reality where he would need to potentially use any of those powers going forward?
I mean, there are parts of the state that are really substantially under-vaccinated. And if you start to see rapid transmission with these new variants in some counties, I could understand how it might apply to certain counties. But I think we're pretty much beyond where we'd have to do this statewide. But, obviously we have to, as the governor said, this is not over. Just because we're loosening up here in California doesn't mean it's over in all parts of California. And it certainly doesn't mean it's over in Baja California, where there's a ton of traffic that goes back and forth every day. So I think we still need to be a little, exercise some caution. And I think that, it's too early to turn everything off and say, done.
Right. Okay. Anything else you want people to keep in mind going forward? Obviously, like you said, take your mask off and go out and live your life. But is there anything else folks need to keep in mind?
If you're vaccinated, take your mask off and go out and live your life. If you're considering international travel, look and see what the restrictions are in the countries you'd like to go to. I heard today that France, Spain, and Greece in the EU countries were open. Others are still requiring quarantines or won't let you in. So you got to be pretty careful about that. That should open up, I'd say, by July. But there's everything you want in California.
That's true. Dr. Rutherford, thank you for joining me.
You're welcome. Thank you. Bye-bye.
Bye. Do want to get you a check of your forecasts now. It is a bit foggy in some places. Warm